Welcome to Vikas Learning, where we are making learning new and different.
In this session, we are going to learn what is Evaluation and Management, E&M services, and what is New Patient and Established Patient.
Evaluation and Management, EM, services in U.S. healthcare refer to the medical services provided by healthcare professionals, primarily physicians, nurse practitioners, and physician assistants, to evaluate and manage patients' healthcare needs. EM services are categorized into different levels based on the complexity of the service provided and the level of documentation required. These levels are defined by the Current Procedural Terminology (CPT) codes established by the American Medical Association (AMA). The services provided under EM are typically bundled into the payment for the surgical procedure itself. This means that separate billing for these services may not be allowed or may be subject to specific rules and regulations set by payers such as Medicare or private insurance companies. Accurate coding and documentation of EM services are crucial for proper reimbursement and compliance with billing regulations. In U.S. healthcare, the terms new patient and established patient are used to differentiate between patients based on their relationship with a particular healthcare provider or practice. A new patient is someone who has not received any professional services from the healthcare provider or another provider of the same specialty within the same practice within the past 3 years. When a patient sees a healthcare provider for the first time or returns after an absence of 3 years or more, they are considered a new patient. An established patient is someone who has previously received professional services from the healthcare provider or another provider of the same specialty within the same practice within the past 3 years. Once a patient has established a relationship with a healthcare provider or practice, subsequent visits are considered follow-up or established patient visits. The distinction between new and established patients is important for billing and coding purposes, particularly for evaluation and management (EM) services. Different reimbursement rates or codes may apply depending on whether the patient is new or established. New patient codes carry higher relative value units (RVUs) and are consistently under the watchful eye of payers. Ensuring accurate classification of patients as new or established helps healthcare providers bill appropriately and comply with coding and billing regulations.
Thank you for watching.